Another month of the the Atlanta Area Evaluation Association Journal Club. Today we have the great Michelle Roth presenting. Just as a reminder, we do these once a month, the third Wednesday of the month from 12 to 12:20. And you're always welcome to join us. And then this is one that's being recorded, and we should be putting up on our website as well in case you have any questions in the hereafter. So
Great.
Take it away, Michelle.
Okay. Thank you, Chris. Welcome to the Journal Club. Hopefully you can see my screen. I thought we could start with some introductions. So if the people on the line could introduce yourself, include your name, where you work, a little bit about what you do, and your motivations to attend the Journal Club, that would be great. I'll start. So my name is Michelle Roth. I work at the CDC in the Office of Minority Health and Health Equity. A little bit about what I do evaluation here. I also do a lot of document review, mapping, some policy analysis, a little bit of everything. And motivations to attend this journal club, well, my motivation was to present this article that I had read about or was engaged with this article, the content in this article, for an evaluation project I used to work on when I worked at an evaluation firm. So I thought it was a really good article. So I thought this was a good opportunity to share it with others. And then I guess if Rhonda or...
Yeah, I'll go. This is Rhonda Williams, and I work in Region 10 Education Service Center, and so I am way in the Dallas, Texas area. And a little bit about what I do internal program evaluation and also some external evaluation because we have about 140 partners that are charter schools and ISDs, and so some of them need the required external evaluation when it's federal funding. My motivation is there used to be one, and I found out about this from EvaluTalk, so obviously I'm not in Atlanta, but there used to be a club that would meet, and I have not received an email or a message in the last 3 months, and I like doing things like this. So I'm kind of ignorant today. This is my first one, but I'll be ready to go next time.
Nice. All right, great. Thank you.
Hi, this is Sarah. I work at PPFA. This is also my first journal club, so really just trying to get a sense of what it is and what it's all about. But for my work, I help different clinics do evaluation, their own evaluations for their agencies. And so I just kind of work to meet many needs of many different orgs.
Okay, great. Thank you.
And then I can go.
Okay.
So yeah, as I said, Chris Vogelai. Where do I work? I am an evaluation fellow at the Centers for Disease Control in the Division of Laboratory Systems. A little about what I do. I guess it's not good enough just to say evaluation. I'm in the training workforce development branch, so I assist with evaluating our training opportunities nationwide for lab folks just all over the country. Doing a really cool project evaluating the incorporation of virtual reality technology into training laboratorians right now. Motivations to attend this journal club, definitely to keep up on the evaluation literature. There's so many journals out there and don't have time to read them all or even as many as I'd like. So always hoping to walk away with just one more piece of information.
Okay, great. Thank you, Chris. So I'll move on to the next slide. So a little bit about our agenda. It's a very short agenda. The agenda is to discuss the article, Permanency Innovations Initiative, the PI approach to evaluation. The reason for selecting this article was because it involves implementation science, which is a huge buzzword here where I work. We're really focusing on implementation science and calling what we're doing implementation science and making sure that what we're doing and calling implementation science aligns with other definitions of implementation science. And also I have worked on previous evaluation projects where one of the people that we contracted, one of the contracted evaluators, worked at James Bell Associates, who was part of this initial Permanency Innovations Initiative. So he had a lot of very integral knowledge about the PII approach, since she was the one that kind of helped sign it and helped kind of put it together and write the initial papers. So, and she tried to sell the PII approach to the Department of Health and Human Services, the permanency department in Minnesota, but it didn't actually end up working out because of budget. But everyone thought it sounded like a great idea and something that they would be interested in doing in the future. So also I'd like to know if anyone has experience with the PII model, or if they've heard about the PII model, or if they've worked with any evaluations or heard of any evaluations that have been used in the foster care system or with child permanency.
That's a negative for me.
This is Rhonda. I haven't.
Okay. And then let's see, guess we can go ahead then. So a little bit of the article, a summary of the article. So one thing that's nice about the PII approach is it combines implementation science and program evaluation into one framework. And it also takes something that's very complicated, and the framework is very simple, which is what a good framework should do, is be able to take complicated things and put it into a very easy to understand, digestible model, which I think it does a job of doing that. The PII approach, there was constant communication between the implementation teams and the evaluation teams. So there were 6 organizations or states that were funded to provide permanency programs or implement permanency programs for children who are in foster care. And it was really nice because they had the implementation teams, or the people that work in these state departments and are implementing these services and providing service delivery. And then there was the evaluation team. So they were in constant communication and working really closely with one another, which is something you don't always see, or you don't always see a lot of communication between the people providing the services and the people evaluating, the evaluators. So this was, I think, a real strength of the model. And then they also evaluated the effectiveness of innovative and evidence-based interventions. So I think that was a really good, a really important strength of the PII model, is that it recognized that departments might have innovative interventions, they might have evidence-based interventions, but they all need to be evaluated for suitability for the given goals and objectives of the project, which was to increase child permanency. There was also the focus on implementation being done right and working. So that was a really strong part of the PII model, where the evaluation was on integrity. Are people implementing their projects right, and are they working? And the PII approach also looked at the grantee projects individually and then also as a whole. This is as a cross-site model. And so this is their model, the PII approach to evaluation. And you see that they have the 4 stages of implementation. So the exploration stage, the installation stage, initial implementation, and full implementation. And so this is really cool because they did everything in a systematic way that allowed for a lot of flexibility and also to be nimble with the different departments that they were working with. So in the exploration stage, there's the data mining, and that included identifying a subset of the foster care population to focus on. And then the research review, that was important for being able to identify an intervention or develop an intervention that would work for the given population. And then also in the pre-evaluation stage was the theory of change. So the grantees worked very closely with the evaluators to develop a theory of change. And I thought that that rang a bell with me too, because in my experience with grantees working on a child permanency initiative, there was a lot of need for assistance or technical assistance for developing a theory of change. I think that theory of change sounds kind of complicated, and it was a new term for many people. So I thought that having the evaluation team and the grantees work together on developing that theory of change really was a great way to start, like getting those logic models going and in the right direction. And then there was the evaluation preparation. And so this was part now after the population was identified, the evidence-based intervention or innovative intervention was identified and developed. The theory of change was designed and articulated in the logic model. Now there was the testing of the data collection procedures. So that was something that I thought was a really great part of this model, to make sure that the measures and the tools that the grantees are using to collect data are collecting the type of data that they want. And then so after the evaluation preparation, now we're into the actual evaluation. So the first part of the evaluation was the formative evaluation, and the purpose of this was to adjust service delivery if it was needed. And I think that that's really, really important here, because the grantees are working with children, and they're working with vulnerable children, specifically vulnerable children. And also in the data mining, a lot of the grantees were identifying this children that were not only in foster care, but specifically at risk for staying in foster care system. So we're talking about a very vulnerable population. So part of this formative evaluation, the focus on adjusting service delivery if necessary, and making sure that there are no unintended consequences or negative effects was extremely important. And I'm glad they highlighted the importance of that in this model. And then also the purpose of the formative evaluation was to determine whether or not the grantees were ready for the summative evaluation. And Heidi, who's the person I used to work with on an evaluation project that was at James Bell Associates that helped develop this model, she worked with the grantees, and she said that grantees did not in any way, shape, or form move on to the summative evaluation until they could really show that their intervention worked. So they might have spent, like some grantees might have spent 2 years in the formative evaluation stage, some might have spent 3 years in the formative evaluation stage. Some grantees might not have even got to the summative evaluation, but they were really intent on making sure that the service delivery was tight, the data collection procedures tight, and that they were 100% ready for the summative evaluation before moving on to that stage. And so one thing that with the article and the PI approach, they suggest here in the summit evaluation to use randomized control trials. And they said that this is helpful for proving that the intervention and the outcome is a causal relationship, and that there exists, which I understand. I guess like one thing I was thinking about is that randomized control trials aren't very practical for a lot of people. I think that a lot of these other steps can be managed by varying budgets. The randomized control trial is kind of expensive. And the PI approach, they had $100 million. So they had the money to do all of this stuff. So I just kind of wasn't sure how feasible randomized control trial would be in this summative evaluation stage. And then they also did the site evaluation, and there's more to where they merged data from the different grantees, and then they evaluated the data from the 4 grantees in different ways to make sure that it was cost effective, the program in and of itself worked, and to kind of create these long-term evidence-based interventions that could be applied to different organizations. So it's kind of a summary of the model and the approach. So I guess some questions I have is for you are, what do you like about the PI model?
Could you show us the model again?
Sure.
I'd have to say I love all that focus on the formative work early on, especially the data mining research review, that collaborative development of the theory of change. I mean, I feel like a lot of the times once you have that good understanding, it can make that evaluation preparation a heck of a lot easier.
Yeah.
So that's nice.
Rhonda or Sarah, do you have anything that kind of you like of the PI approach to evaluation, or things that you thought were the strengths of this model?
I'm just still thinking, this is Rhonda. And I think what I'm thinking is I'm trying to see like how this model is different, but I heard what you said, it's really for human services, in particular those that deal with children. So I'm just still thinking, but I like this bottom about the data mining, because that's always a great place to start.
Yeah, exactly. Like the fact that they're focusing on the population right from the start is pretty cool, that they recognize the importance of that. Sarah, did you have any thoughts on the model, or anything that you found was kind of something that popped out at you as a strength or something liked about the model?
No, I think I'm still absorbing.
Yeah, it is. There's a lot to absorb for sure. And then I guess I would say, like, if you have any thoughts about something that you thought may be missing, or something that you've done in your own evaluation work you think could be incorporated here, or there could be a focus on here?
The only thing I would throw out here, and it's probably implicit in here, but that some of these stages exist in an iterative process. And like I said, I'm sure it's well understood by the people that put this together. But even this model, this graphical model, is a good tool to, like one thing I definitely love is those early parts, making it explicit that evaluation work is done before both the program is in place and the that evaluators need to be brought in early. But just for like one extra thing, so that as you're communicating this approach, the evaluator could make reference to some sort of iterative nature between like going back from formative to evaluation preparation to prepare for the summative evaluation, or just how, anyway, you can pick up what I'm putting down.
Yeah, definitely. All right, well, so that is this session of the Journal Club. We're a little bit over time, but I'd like to thank everyone for joining, and hopefully you'll join the next Journal Club. There'll be notices about what the article is and the presenter for next month. So
And
thanks again for joining.
Yep, and we always put it out on Eval Talk, so if that's how you get it, you'll see it come soon. Awesome.
Right. Thanks, Chris.
Yep, thank you, everyone.
Thank you.
Thanks, Sarah.